Hi, I'm Dr. Alan Wolchansky, and I'm a chiropractor. I have a private practice, and I also teach. I'm an adjunct faculty at Logan College of Chiropractic. But I wanted to share a little bit about my background. I came to chiropractic because I hurt my back a number of years ago. When I was a college student, I played just some intramural football, and I hurt my back and didn't think much about it. And then after I was married, I hurt my back by picking something up, and I was in bed for a couple of days. And then many years later, I picked up a bag of groceries, and I had excruciating, searing low back pain going down my leg. And it was so bad that I just couldn't even get out of bed. I had to roll off the bed and cross my arms like this, and my wife would drag me to the bathroom. I just couldn't. It was just terrible, excruciating pain. So at the previous time, I had been seeing an acupuncturist for a while, and the acupuncturist said, Alan, I can only help you so much. You need to go see a chiropractor. Well, I really didn't think a whole lot of that, and I finally had a friend who said, why don't you go see my chiropractor? So for 6 months, my personality and my good humor just went down a slippery slope. My personality changed. I was walking with a limp. I was dragging my foot behind me, and I was in pain all the time, even though I was taking muscle relaxers and painkillers. And the neurosurgeon wanted to do surgery on my herniated lumbar disc, and I didn't like the idea of being cut on. And so my friend kept after me, and he really embarrassed me to go to a chiropractor. After the first 2 or 3 sessions, I went to the chiropractor, had about 90% of the pain was relieved, and I became enthralled with that. How can you do that without surgery or drugs? Now, surgery and drugs are really important at various points, so when they're necessary, they're necessary. But I chose something else, and it happened to work for me. And after that, I became interested in chiropractic. Though I have a master's in social work and practiced for a long time, I had to go back to school to get the prerequisites in the hard sciences. So it means I need to go back to school to get physics and all the chemistry and biology that I didn't have when I was in undergraduate school. So I did that. It took a while. Then I decided to go to school, and I came here to Logan College of Chiropractic. And I've been very happy with that ever since. So I do want to say that I have experience with patients who have MS. In fact, there was a student who became a good friend of mine who entered chiropractic school a semester after I did. And he had just come to Logan at the time, and he had just been diagnosed with MS. So he didn't have very many symptoms at the time. He was a newlywed fellow, and within the first year of his time at Logan, he had to withdraw because he couldn't physically do the things he needed. It was called on to be a student and the physicality of it. And I've known him for many years, and I've had other people in my practice as well. So that's my background. So you know a lot about MS, and so I apologize. I forgot to ask for a small lectern up here because I'm going to refer to some of my notes. So, I'm just, human, just like everybody else. Everybody else has faults and things we think about, and I thought about it too long, even though I was asked multiple times, what do you need for your presentation to do it? So it's the one thing that, Okay, so I apologize for looking down at my notes so much. The U.S. National Library of Medicine defines MS as an autoimmune disease that affects the central nervous system. Well, we know that the central nervous system is what's called the brain and the spinal cord. So, ta-da, let me review this. We know where the brain is. This is a model of this is a plastic spine modeled after an actual spine. So we know that the central nervous system, the brain, resides in the bony vault of the skull. Once that brain tissue comes out of the skull, it changes names. It's called the spinal cord. And the spinal cord remains within a bony structure as it goes down through each of these bones, which are called vertebrae, which makes up our spine. So the brain tissue is very delicate. So we know that the the central nervous system is surrounded by each of the axons of the nerve are surrounded by a myelin sheath, which serve as a, if you will, an insulator for the nerve itself. The nerve conducts electrical current through the nerve, so signals go from the brain to the body and the body back to the brain. Anywhere that insulation is interrupted or destroyed by inflammation, that's where the signals don't travel very well. They're slowed down, and eventually sometimes the signals actually stop. So we don't get the activation or what we need to, the information from one part of the body to the other, and those body parts, wherever they are, cease to exist or to function. So we know that nerves go to every single part of the body, right? So the best way to think of, I guess, the nervous system is almost like an electrical grid that you can imagine in your mind's eye, that you have the electrical station at some point somewhere, and that takes a cable, and that cable runs with electricity to your house. But as it runs to your house, it gets to the electrical box outside your house. Then there's another cable that comes in, and that goes to a light switch, which is maybe on the wall. And then to turn the light off and on, you have to move that switch, but there's another cable or wire that goes up to the ceiling lights there. So wherever there's interruption, that's where the problem is. So we don't know exactly where that is. You can find that in terms of the body when they do MRIs or various other studies to find out where they are. However, we know that MS is a progressive disease, can be progressive, and that there is no cure for it at this time. However, the thing that's important to realize is the management of the symptoms that are there with multiple sclerosis. So what are some of the typical symptoms that MS patients have? They have pain, they have dizziness, they have numbness and tingling, walking or gait difficulties, muscle spasm, and spasticity, just to name some of the things which are there. And I think you're probably familiar with all of that. So that brings us to MS care in multiple sclerosis. So chiropractic is a natural health care profession that focuses on disorders of the musculoskeletal system and the nervous system, and disorders of those effects, and wherever those disorders are, the effects on them affect actually general health. Chiropractic care is used most often to treat neuromuscular skeletal problems, which can be complaints such as back pain, neck pain, pain in arm and leg joints, as well as headaches. Doctors of chiropractic are often referred to as either chiropractors or chiropractic physicians. So the term chiropractic comes from Greek. You break it down. Chiro means hands, and practico means use of. So it's the use of hands in taking care of people. It's a natural type of treatment which is there. It's drug-free, and we use the hands-on to deliver what's called an adjustment or a spinal manipulation. The purpose of that manipulation is to free up areas of the body or the joints which are not moving freely. So we apply a controlled pressure into an area which is not freely moving. It's hypomobile or restricted, and that's usually a result of some form of tissue injury, or that when the spine becomes hypomobile, doesn't move freely, we get some inflammation in there because the body is meant to be able to move all the time. So the inflammation causes decrease over a period of time in the myelin sheath. So we have here the model of the spine. The spine is made up of 33 bones. We have 7 bones in the neck, 12 bones in the mid-back or the thoracic spine, and then 5 in the lumbar. Then we have something called the sacrum, which is a triangular bone, which is back here. You can't see it very well from where it is, but it's here. And then we have the coccyx. So what happens in there is important to chiropractors because we believe that the function of the body is based on interference within this nerve conduit that goes from the brain, the spinal cord, and out to peripheral nerves. So, as I said before, the brain is housed inside of the bony vault, the skull. When the brain tissue departs or leaves the skull, it passes through a big hole at the bottom of the skull, and that's called the foramen magnum. But it just means big hole. But it's brain tissue, and when things come to various intersections in the body, they often change names. So once the brain tissue passes out through the foramen magnum at the bottom of the skull, it changes into, it's called the spinal cord. The spinal cord goes down through each of the bones here, which are called vertebra. And as it comes down through here, what happens is it will give off branches, and they come out through various holes in the side, which are the natural type of thing. And once the spinal cord comes out through here, through the various holes, once again, it passes an intersection, if you will. So we've all driven on the road before, and we're going down the same road, but we come to an intersection, and all of a sudden, the road changes names. The same thing is true of the body. So we go from the brain to the spinal cord, and once the spinal cord gives off these other pieces of material, nerves, it changes to what's called a peripheral nerve. So everything in the body can be affected. We know that the brain controls everything in the body. The nerve impulses go both ways. It goes from the brain to the terminal part of wherever that is, whether it's to an internal organ or it goes to muscles. And then we get a return which comes from the outside of the periphery of the body back in through the body and up to the brain for various responses. One of the things that Mary Kay talked about was nutrition, and I'm going to briefly mention that, but I'll do that since I had a sip of water. You know, nutrition's really, really important. Everything she said is so essential to your health and doing things that you just can't leave it out. If you do, there are consequences. So water is really important. You have to hydrate, right? Why? What does water do? Water is going to come into your body. It's going to flush the system. It carries out some of the toxic waste which is there because it goes through the system. It comes out through the urine and through other parts. And if you don't have enough water in your body, you can actually experience cramping, muscle cramps, due to lack of hydration, lack of water. So doctors of chiropractic seek to reduce pain and improve the functionality of patients, as well as to educate them on how you can account for what's going on in their own body through exercise, through nutrition, through ergonomics of how we use our body, and other therapies to treat pain. So we deliver the chiropractic adjustment or spinal adjustment there to put motion into those segments which are not moving freely. The consequence of that is to sometimes take pressure off the nerves, but also there's a stretch reflex in what happens in there that feeds back into the body. So that what's important for the body to do is to try to find alternative ways for nerve pathways to get back to function as much as possible. We don't understand exactly how that works, but there's a biochemical reaction that takes place in the body. We know that there are stretch reflexes within the muscles. We know that muscles get contracted. They get spastic. Spasticity means that a muscle will have a sudden sort of impulse to contract. Well, on the opposite side of the muscle, well, anytime you have muscles, you always have opposing muscles. So one is going to contract, the other one's going to lengthen. So if you think about your bicep, which is a muscle here, okay, when that contracts, the tricep muscle has to relax here. But if you have a spasm, how do you relax that? So in chiropractic, we work by doing some muscle work and doing some stretching of the muscles to be able to try to alleviate some of that. So there's something called a Golgi within the muscle fibers, and this is, I don't want to go into a lot of physiology, but we have golden GTOs. They're Golgi tendon fibers, and those tendon fibers sort of measure the tension in the muscle. And then we also have muscle spindles, which actually deal with the length of a muscle. So the muscle has to be able to lengthen and shorten. So by working in muscles and doing adjustments, that affects it to sort of, if you will, to reset the mechanism within the body. And that's what we're working for, is to do that. So there's a number of different ways that we work with it. We do spinal manipulation, sometimes called chiropractic adjustments. We do something called interferential or electrical stimulation, which is to help try to relax some of the muscles and block some of the pain fibers to reduce some of the pain. We might do ultrasound, which is also to relax some of the muscles there. We do muscle work, which can be just a simple sort of stretching of muscles. Oftentimes people have what are called trigger points in their muscles, which are knots in the muscles. Muscles work all the time, whether you move them or not. So muscles will oftentimes develop knots in the muscles called trigger points, and that's just a buildup of lactic acid within the muscle fiber itself. And one of the ways to break up that lactic acid is through manual pressure in there to break up those trigger points and try to have the body reabsorb that and then flush it out of the muscle tissue itself. We also do a lot of exercise. So we will work with patients to do exercises in the office, which help them think about what they're doing and how they are physically using their body. And it's probably some of the same things that are done at the MS Center as well through their exercise program. But by doing these exercises, it's crucial that people do them. So we start with them and we work with them to do it, to teach them how to properly do the exercises. Then they have to have the responsibility of doing those exercises at home. Because the amount of time that you spend with any physician, whether it's a chiropractor, a neurosurgeon, a neurologist, internist, is very small. So if you spend half an hour to, let's say an hour at your visit with the doctor, how much time do you spend the rest of the time of the day by yourself? So if it's 60 minutes, how many minutes are in an actual day? 1,440 minutes. So what you do on your own is really important. We encourage people to take responsibility for their own care, because there's only so much that we can do. What you do outside of our office is your responsibility. So we really encourage people to do the things that we do, that they should be doing. And frankly, not everybody does it, and it has to be done in stages. So you recall watching TV and you see these people who are jumping and moving and doing different things on TV. They're losing weight. They've got ripped bodies there. Well, those people, by and large, started with those type of bodies, and they're doing those activities every day. And so a lot of people buy the videos on how to do it, but after they start doing it, they tend to drop off. And why is that? Because everyone thinks in their mind that, I shouldn't say everyone, most people think they're going to look like that in a very short period of time. But it takes the diligent concentration of being able to do it over a long period of time. And if you start with exercises or anything that you're doing, and you're doing too much at one time, your body tends to be physically exhausted from it, and we naturally say, oh, that's too much for me, I'm not going to do it, I won't, or you begin to drop off. So anything has to be a gradual continuation as you do it. In addition to those type of things, there's nutrition. And you had mentioned this, Mary Kay. Nutrition is essential. So there is a difference in terms of calories. So if you had an apple and a muffin that have the same number of calories, let's take a number, 100 calories there. They're not equal because the muffin has sugar in it. It has other ingredients which may not be so helpful. You take it, and it doesn't have the fiber that an apple is going to have, as well as it has vitamins in that. So one has to be careful of what they eat and how they eat. In the same way that, most of us drink soda. Soda tastes great. It's bubbly, it's effervescent, it's got sugar in it or maybe a sweetener to it, but it's really not the best thing for our bodies. Water's the best thing for our bodies because it comes into our body and it cleans things out. But one starts from a very simple aspect of being able to change things, starting with one thing and moving on to other things to incorporate things as they change within their bodies. So one of the things I mentioned was exercise, and well, let me go back to nutrition. So there are things that you eat which are inflammatory to the body, and you can look online to find those type of things. You'll see programs on TV about that. So we want to try to reduce the inflammation to the body. When it's in the central nervous system, they really can't reduce some of that, from a chiropractic point, the inflammation to the myelin sheath, which protects the axon nerves there. But we're talking about the concomitant parts of what's happening with the rest of the body to relieve some of the pain, discomfort, muscle spasms which are going on. So one of the things I mentioned is we do some exercise. So it's important to do some exercise every single day. So I'm going to ask you to do some exercises here. So we're all sitting in a chair. Not all of them have arms to them.
We're going to have to rotate.
Okay, so how much time?
About 2.
2 minutes, okay. All right, so you can do, okay. So it's important to physically challenge your body, and it doesn't have to be a lot as long as you do it on a regular basis, and the stronger you get, the better it is for you. So when you're sitting at home, if you're sitting in an armchair, watching TV, so let's just do some dips, some simple dips like this. Just use your arms to move up and down, okay? Don't do this in a chair that has wheels on it, okay? That's not good, okay? You want to do that. Okay, the other thing that you can do while you're sitting in a chair that doesn't have wheels, practice getting up slowly, not jumping up, but use your leg muscles. Use your leg muscles. Really important part of your body to do that. Now, what else can you do while you're sitting there? Have you ever put your legs out like this and just done a little bit of kick? Well, as you're doing that, you're moving muscles in your legs. You're increasing the blood flow through your body. You're moving joints. And if you do that with me now, you'll feel not only of your legs doing stuff, but your abdomen, your belly gets a little bit tight. So you're really beginning to focus on different aspects of the body to do things with. You can also get something, resistant bands. You've probably seen them on TV and those various commercials. You can buy them at health food stores. You can buy them at gyms. This is called a TheraBand. It's just a resistant band. They come in different colors because they have different resistance to it. You can hold it. You can do some things for your bicep here. You can do curls like this. Okay? You can take it out to the side. You can take it up. Okay? So there are a lot of different things that you can do at home. And you can create some of your own exercises. You can put it behind your body like this and wrap it around and do sort of punches or slow movement here. What's really important is not so much to do it quickly, but to do it, to challenge the muscles by doing it slowly. Okay? When I go to the gym, I often see guys doing bicep curls and they're going. That's not doing anything to build the muscle. In fact, it really breaks the muscle down. What's important is to do a slow, controlled muscle contraction. Okay? So you said we don't have much time. I had more material, but thank you for it. Do we have any questions?
Is there any reason an MS patient should not seek chiropractic care?
That's a good question. No, they can seek chiropractic care. But the thing I want to say is that, we work with other physicians and healthcare team members. So what we do is we do an examination, we diagnose, and then we treat people. If we're not able to help someone then we refer out to other people. We're also available to work, as I said, with other people in healthcare teams to co-manage situations, conditions which are there. So we don't work in isolation. We really want to talk to and be part of the healthcare team because this is such a broad issue that needs attention from all to try to maximize what's best for our patients. Any other questions?
Anybody has questions?
Utilizing chiropractic for the symptom management, does it often allow patients to come off of medications that they usually treat all those other things for?
Generally, no. And because chiropractors don't prescribe medicine, we don't have the ability to prescribe medicine. That's up to the medical doctor or the DO or the neurologist to do that. But most of the time, I haven't seen that in my practice. People go through various different stages. They can have remission, in other words, that the symptoms decrease or are not there, but then it comes up again sometime later. All patients are different. Some have it more, if you will, more severely than others and have a big increase in what's going on with them in terms of disabilities they have, and others sort of level off.
But Alan,
Yes.
if a patient has chronic pain, for example, back pain,
Right.
and have been dependent on medication just as you were, isn't there a possibility that
Yes.
your intervention
Yes,
is
true.
going to lower those types of symptom medicine?
Right, yes. I was
That's
thinking more
not
of,
their disease medicine,
Right.
not the ones for progression of their MS, but the ones that are managing symptoms. We have a lot of patients that end up with polypharmacy in a bad way because we're treating dysesthesias, tingles, and burning. We're treating back pain because of the way they walk. We're treating spasticity because of the tone. So how can chiropractic modify that?
Okay.
And it sounds like it can.
it can, and it does. There's a lot of research into that now. In the last 10 or 15 years, there's been a lot of research to that, Dr. Green, and it's true. So we can modulate the pain through the chiropractic adjustment and some of the modalities such as electrical stimulation, spinal traction to deal with those things. And yes, we can. I was thinking more of like the interferon and the disease type of stuff. And so, right. Now the other thing in chiropractic is I can't tell someone to stop their pain medication. They have to decide that themselves. That's out of my scope of practice.
But that's that whole team approach.
Yes, it is. Right. Yes.
How do you determine what strength of elastic band that you might need?
Well, just to go in and try them. Okay, if you're working with a physician, they'll help, or a physical therapist, they'll help you decide what's best for you. Depends on your own strength at that particular time, and you can test it out. This one doesn't have a lot of tensile strength to it, but you can, if you doubled it up, that means you have greater tensile strength, or you even did it once again. So you're welcome to play with that.
All right,
Okay.
any more questions? Thank you so much.
Thank you for joining me.